Good evening. May 24th, 22 meeting of the Human Services Committee will now come to order. Will the clerk please read the roll call?
Mr. Blankley is excused. Mr. Brew? Mr. Brew is present. Ms. Delvecchio Hoffman is excused. Mr. Dondorfer? Mr. Dondorfer is present. Ms. Hasman? Ms. Hasman is present. Mr. Keller? Mr. Keller is present. Chairman Milne?
Here.
Chairman Milne is present. Ms. Smith? Ms. Smith is present. And Mr. Udelson? Mr. Udelson is present.
The clerk's office is happy to announce that the audiovisual professionals have completed the necessary adjustments needed to address the live microphones when streaming on YouTube. Going forward, all microphones should only be considered live when unmuted by the clerk's office when legislators obtain the floor. The clerk's office will continually monitor each microphone in case of any lapses or gaps that may have been missed. Thank you very much. Mr. Clerk, is anyone signed up for the public forum?
There is not.
This got loud.
Yes, it did.
And is there anyone present who is not signed up to speak that would like to address the committee at this time? Seeing none, I believe we have a presentation. Pat Gooch, Senior Planner, Monroe County Planning and Development Department, with the 2023-2028 Capital Improvement Program. Mr. Gooch?
Thank you, Mr. Chairman. You should all have a copy of the recommended 2023-2028 CIP. This report reflects the culmination of an 11-month process beginning in late summer with departments proposing a 6-year funding plan for capital projects. A committee reviews the proposed projects and requires changes based on project priority and fiscal constraints on the program. After review by the county executive, the CIP is submitted to the county planning board. The planning board reviews the CIP, holds a public hearing, and sets priorities for the capital budget year, which is the first year of the CIP, or 2023. The planning board returns the draft CIP to the county executive, who then submits the recommended CIP to your honorable body. At the July meeting of the legislature, you will set a public hearing for August, and then, upon your favorable review, vote to adopt the plan. There are no funding approvals associated with taking action on this referral. The medical examiners program is found on page 10 of your CIP. Each year, the office upgrades one of its mass spectrometers or gas chromatographers to enhance speed and analytic capability in determining cause and manner of death. The medical examiner's proposed program accounts for 0.3% of the total capital program. The Monroe Community Hospital program begins on page 16 of the CIP. MCH is a 566-bed chronic care residential health care facility owned and operated by the County of Monroe. The hospital is nationally recognized for its research in geriatrics and chronic diseases. As a dynamic healthcare facility, MCH must continue to keep the grounds, physical plant, kitchen and laundry, medical service, patient furnishings, and information technology up to date and functional. In total, the 6 MCH projects account for just over 3% of the capital program. I'll be happy to take questions when you get to this item on your agenda. Thank you for your time.
Thank you, Mr. Gooch. Questions? We'll do that. Okay. Yeah. Next item on the agenda is the approval of minutes. You have the April 26, 2022 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of this day. Comments? Next item on the agenda is new business. Mr. Clerk?
Referral 22-0161, adopt 2023-2028 capital improvement program.
A motion by Legislator Smith, seconded by Legislator Brew. Are there any discussion? Legislator Smith?
Through the chairman to the administration, what new projects have been added in the years 2023 to 2027 that are relevant to this committee?
Through the chair, there have been no new projects that we believe are relevant to this committee. However, there are new projects that may be interesting to this committee. However, we've prepared the information regarding the toxicology lab equipment, but we can go over other projects if interested.
Thank you.
And are there any other, yes, Legislator Brew?
Yes, through the chair of the administration, as a follow-up to Legislator Smith's question, are there any new projects that have been added for the year 2028?
Through the chair, yes, there are, I believe, 9 new projects that have been added for the year 2028, the farthest year of this current CIP. The first is the Monroe Community College Optimized Campus Wayfinding. The Monroe Community College is also engaging in enhancing pedestrian safety and connectivity, improve transit services and facilities. The Department of Environmental Services Division of Pure Waters is focusing on a Irondequoit Bay pump station improvements. They're also focusing on general CSOP tunnel system improvements, where that is the Combined Sewer Overflow Abatement Program, the tunnel system that runs throughout Monroe County underneath our feet. There's also the Northwest Quadrant Wastewater Treatment Facility electrical improvements by DES Pure Waters. Moving to DES Engineering and Facilities Management, there is a City Place General Improvements Project added in 2028. The Department of Parks has added a Oatka Creek Park Master Plan update scheduled for 2028. The Department of Transportation, Highways and Bridges is planning a Highway Preventive Maintenance number 10, which involves several roads in Henrietta and Brighton. They also have Trolley Boulevard, Long Pond Road to Lee Road, Jacobs Road Bridge over Yantee Creek. The Department of Public Safety has scheduled Special Operations Vehicle Replacement for the Fire Bureau. The Monroe County Office of the Sheriff has scheduled the Radio Communications Infrastructure for Jail and Court Bureau. They have also scheduled in 2028 Sheriff's Special Operations Building upgrades. And that is all.
Thank you. Just through the chair of the administration, just point of clarification. The first item you mentioned was MCC what?
Through the chair, the first item was the Monroe Community College Optimized Campus Wayfinding.
Optimized campus what?
Wayfinding, which is signage. It is intended to provide new signage with consistent colors, fonts, and themes to help MCC students navigate the campus, in the Brighton campus specifically.
Thank you.
Thank you, Mr. Gooch.
Floor?
And I'm sorry, Legislator Hesman did, okay, I thought I saw a hand. Any other questions or comments? Legislator Keller?
Through you, Mr. Chairman, to the administration. Just referring to the toxicology lab equipment proposed budget, you indicated that annually a new mass spec or gas chromatograph is purchased. I may be misreading the table, but there's no expenditures anticipated in 2023. Why is that?
Through the chair, the medical examiner's office programs to replace some equipment annually. Sometimes that happens. Sometimes they wait a year and accrue funding. In either event, they are scheduled to replace equipment as needed as the equipment ages out, but also as new equipment comes on the scene that is required for their work.
Okay, yeah, thank you. Just a quick follow-on. I'm the last person to recommend spending money, but given the backlog in that particular office, it seems perhaps bringing one of those instruments in earlier rather than later might be beneficial. But of course, the medical examiner's office would know better than I. But thank you. I yield the floor.
Through the chair, I do apologize. The medical examiner's office could not make it tonight due to unforeseen circumstances, so they can't get into the details of their program, but they do work collaboratively with us to make sure that they're purchasing equipment as needed.
All right, thank you.
Do we have any other questions or comments? Seeing none, we have a motion and a second. All those in favor, please signify by saying aye.
Aye.
Any opposed, the same? Seeing none, carried.
Referral 22-0167, authorize the implementation of a project labor agreement for the Specialized Secure Detention Facility Capital Project.
Motion by legislator Brew, seconded by legislator Dondorfer. Are there any discussions or questions? Legislator Brew?
Yes, through the chair. I think I heard this explanation last night, but I'm requesting to hear it again regarding just providing a short summary of exactly what the project labor agreement and how that is intended to save money. I did hear that there are guidelines for apprenticeship programs that do feed into the county's overall plan for workforce development. I applaud that, but if you could just elaborate a little bit more on the PLA and how that does benefit the county.
Yes, through the chair. So the intent of the PLA is to create a uniform work situation for the project. It allows all the different trades to maintain the same level of consistency in terms of how the shifts begin, how the workers are supposed to be on site, what activities they're supposed to undertake. There are a number of things that are savings on the project. It would be minimizing flexible shift starts, so everybody starts at the same time, gets more productivity out of the workday. Also being able to work 10-hour days, minimizing the money that's put into industrial funds, which helps provide savings. There are union and non-union apprenticeship programs, which helps the ratio of apprenticeships or apprentices to journeymen so that we can get more apprentices on the project. We limit holiday pay to minimize the number of holidays that are being performed. Work break reductions, so the crews are working more productively and spending more time on the job. Wage concessions, which is essentially in different categories. There may be a heavy and highway category and a building category. We are shooting to get this at the building category, which is a lower rate, save some money that way. And management rights, which basically gives the contractor who's on the site more control over how this process works. So the intent is that the unions have to provide labor through the union halls, but the contractors have the ability to direct a little bit more how the labor is done so that they're not directed too much by the unions, but have a chance to do their means and methods themselves. It also has the opportunity to put a contribution back to the Rochester Careers of Construction, which is aimed at getting minorities and women involved in construction and through the apprenticeship program.
Thank you.
Mr. Udelson?
Very brief summary of the project.
Yes, through the chair. So this is a construction of phase 2, which is the new facility, which provides new specialized secure detention beds for the adolescent offenders required to raise the age. We're creating 48 new beds in addition to the 10 beds that were established in the first phase that was done when Raise the Age came about in 2018. So there'll be a total of 58 SSD, specialized secure detention beds, which allows the staff quite a bit of flexibility on how the youth, if you will, the population is distributed throughout the facility. We're also going to be enhancing programs that are required by the state, both for the adolescent offenders, but also for the juvenile offenders and juvenile delinquents. So including the new gym, new recreation, education, healthcare, both mental and physical healthcare, and visitation, security. All those facilities are now being enhanced to provide a better opportunity for the kids to benefit from being incarcerated, if you will. The intent of the project is to finalize design by the end of the year, be out for construction next year, and have occupancy probably fourth quarter or so of 24.
Welcome, Mr. Udelson. Anything else? Any other questions or comments? Legislator Brew?
Yes. Administration, a result of Legislator Udelson's question. Regarding the project design, it was my understanding that what was problematic in the detention center was when the detainees would come together in common areas. And I'm assuming that the design and construction of these 48 new beds take that into account, where the juveniles are not in the same confined areas than the older detainees are.
To the chair, yes, it is. We've gone to great strides to provide the maximum amount of flexibility to the staff so that they can place the different populations in different areas. Not only do they have the 3 age groups, they have different categories of people that are in gangs and all that type of thing. So we want to give them the maximum amount of flexibility to be able to put students, or not, they're not students, they're the youth, into different locations. We're also designing this as a circular circulation type project rather than a linear, so that as the children are moving around the facility, they don't cross each other's path. We have had quite a bit of discussion with the city school district to get their input on how they like to see the students show up for classes. So again, they're not crossing over each other, and trying to minimize as much as we can sight and sound separation in conformance with state requirements.
Through the chair, one more follow-up question. What is the estimate of the additional county staff or contracted staff that would be required to support the 48 new beds?
Through the chair, we anticipate that the staffing will be just about double to accommodate the additional beds.
I'm sorry, I didn't hear your response. Could you repeat that?
I said, through the chair, the staffing will probably be about double to accommodate the additional 48 beds.
Thank you. So, I'm sorry, as a follow-up, double would be what in a?
Currently, we have 48, and according to our, the requirements for staffing ratio, 48 additional beds would require additional staffing to provide safety and security for the facility.
So, okay, so if I understand, that's 48 additional staff.
Correct.
So, through the chair, would those be county employees, or would they be contract employees, or would they be some combination of the two?
County employees.
Thank you.
Legislator Brewer, are you good?
Yes, thank you.
I'd ask again if there are any other comments or questions? Seeing none, we do have a motion and a second. All those in favor, please signify by saying aye. Aye. Any opposed? Seeing none, carried.
Referral 22-0179, acceptance of funding from the New York State Office of Addiction Services and Supports, and amend Resolution 517 of 2021 as amended by the resolution adopted pursuant to referral 22-0131, authorizing contracts for the provision of mental health, developmental disability, and alcoholism and substance abuse services in 2022 for the Monroe County Office of Mental Health.
We have a motion moved by Legislator Dondorfer, seconded by Legislator Keller. Are there any comments? Legislator Husman? Yes, ma'am. Noted. Any other comments? Any questions? Hearing, seeing none. All those in favor, please signify by saying aye. Aye. Any opposed? The same. Seeing none. Carried.
Referral 22-0180, amend Resolution 132 of 2021 to amend and increase the contract with URMC Labs, a division of the University of Rochester, for laboratory services at Monroe Community Hospital.
This has been moved by Legislator Keller, seconded by Legislator Smith. Is there any discussion on this? Noted. And are there any other comments or questions? Seeing and hearing none. We have a motion and a second. All those in favor, please signify by saying aye. Aye. And any opposed, the same? Seeing none.
Referral 22-0181, acceptance of a grant from the New York State Division of Criminal Justice Services for the Paul Coverdell Forensic Science Improvement Program, Office of the Medical Examiner's Forensic Toxicology Laboratory.
A motion by Legislator Smith, seconded by Legislator Brew. Any questions or comments? Hearing and seeing none. All those in favor, please signify by saying aye. And opposed, the same. See none? Carried.
Referral 22-0182, acceptance of a grant from Health Research for the Expanded Partner Services Initiative.
Been moved by legislator Brew, seconded by legislator Dondorfer. Any questions or comments? Legislator Smith?
Monroe County's role in administering this project.
Through the chair, we staff investigation of people with HIV that have fallen out of care. And our goal is to get them back into care so that they are no longer contagious to the extent that we can.
Thank you.
Are there any other questions or comments? Seeing none, we have a motion and a second. All those in favor, please signify by saying aye. Aye. And opposed, the same? See none? Carried.
Referral 22-0183, amend Resolution 391 of 2019 to amend and increase the contract with Ultra Mobile Imaging to provide radiology services at Monroe Community Hospital and for the Monroe County Department of Public Health Tuberculosis Control Program.
It's been moved by legislator Dondorfer, seconded by legislator Keller. Is there any discussion or questions on this? Seeing none. All those in favor, please signify by saying aye. Aye. And opposed, the same. See none, carried.
Referral 22-0188, authorize a contract with WellNow Urgent Care for medical occupational examinations and consultations for Monroe County employees and the Monroe County Hazmat Team.
It's been moved by legislator Keller, seconded by legislator Smith. Are there any questions or comments? Seeing none. All those in favor, please signify by saying aye. Aye. And any opposed, the same? Carried.
Referral 22-0198, amend the 2022-2027 capital improvement program and 2022 capital budget to add a project entitled STD Clinic Relocation, authorize financing for the project, and authorize acceptance of reimbursement from the City of Rochester for federal relocation dollars.
Been moved by legislator Smith, seconded by legislator Brew. Are there any questions or comments on this subject? Hearing and seeing none, all those in favor, please signify by saying aye. Aye. And any opposed, the same? Carried. And are there any other matters to come before this committee? There being no other matters, the May 24th, 2022 meeting of the Human Services Committee will stand adjourned. The next meeting of the Human Services Committee will be held on Tuesday, June 28th, 2022 at 5 p.m.